So, hi, I'm Ann McGuire. I'm the founder and owner of Healthcare Pathfinder. A couple of team members in the room, Victoria Beeler and Ginny Jameson. And I'm going to tell you a little bit more about our backgrounds just to give you some perspective as to where we're coming from and sharing our information. So focusing on being aware, prepared, and proactive in managing your health and long-term care. And based on the audience, it's a nice, small, intimate group here. We can kind of zero in on really what we want to focus on. So we're a professional healthcare advice, advocacy, and management firm, helping people find, understand, manage, and advocate for their health and long-term care insurance benefits. We create peace of mind, as all of you do, probably all in what you do with your businesses and work and with family. But clients really, they go, so happy that you've been able to take care of this situation. So hopefully this will help you create some peace of mind and understanding how to manage your health insurance or your parents or your children's and your long-term care insurance and all of that. So hopefully this will be helpful to you all. So our background, and I'll go through this quickly, is we have a very diverse group of us within the healthcare space, but my background is nursing. I'm a nurse and I'm a certified case manager. And I have, going back, I started volunteer for Post 53, the ambulance, when I was 14. Driving an ambulance at 16 and, EMT at 16, all of that. And then went to nursing school, ended up working in surgical trauma intensive care. They called it the SICU at Yale New Haven Hospital. Didn't really like the hospital, went to home care, then managed care. And then I ended up in the advocacy space and helping people, clients, or individuals find, advocate, and manage their health and long-term care. And I'd worked at another firm before I started up mine, which is very similar. Difference being is that it's more comprehensive. We're looking at the whole picture from the experience, including my nursing case management background. So we've got experience with Victoria, has sales and disability background. She's happy to be on the advocacy side and not selling, and helping to really make sure people have the whole picture. Ginny comes from healthcare, home care, and assisted living, and other doctors' offices. So she's been in many different arenas as well. And then Therese has claims and disability experience as well. She's become our long-term care specialist as well. So that's sort of us. Kind of went through a lot of this. And a couple of us are licensed in life and health. And then these affiliations that we have here are resources for you. Case Management Society of America, Aging Life Care Association, Alliance for Professional Healthcare Advocates, Certified Senior Advisors. All these sort of affiliations are resources that they can be for you. Okay. I think I went down instead of over. Okay, so be aware. This is, and again, we can dive into specifics. And if you want to, if you have a question that you just have to ask because you can't move on without asking it, please do so. Otherwise, we'll sort of wait till the end. Okay, so being aware of healthcare coverage options. And I'll just welcome. So we're going to be looking at coverage options, financial responsibilities, when you can and must change coverage. So I think probably part of the focus right now is on the open enrollment period. So let's talk about kind of looking at the different types of plans. Not sure what you have is you may have employer group. That means, who you're working for or who your maybe spouse is, may have coverage under employer's plan, self-employed, whether you're self-employed, but you have an employee who's working for you, sole proprietor, and this sort of qualifies you in different areas, also depending on what state you live in too. Individual family, marketplace. It doesn't have to actually be in the marketplace. We can call the insurance company directly. Sometimes you can get a better network if you call the insurance company directly. So often people think, oh, I need individual insurance. I just go to, the marketplace, which is in, state of Connecticut. So I will answer more questions if you want to get more specific about that later. COBRA, that's often if you've lost your job or you're leaving your employment, you have gone through a divorce, you've had a loss of a spouse, your child may have aged off your policy. COBRA is continuing benefits after the employer benefits, but they become private pay where you're paying for them. It becomes individual. And then Medicare, Original or Medicare Advantage. So I don't know if any of you are here. Is everyone here for themselves, or are you here for family members as well to learn? Self. Okay, good. That helps because I could dive into Medicare if that's coming up for some of you as well, but that's often what I talk to people want to know for their parents. But I recommend if your parents, you're involved with taking care of your parents, is to know what their insurance is and to check whether or not they should be reviewing their coverage. This is the open enrollment period. It just started today, the 15th, or yesterday, sorry, the 15th, through December 7th. So that's an opportunity for them to change off of their plans. So I'll just say a little bit about original Medicare versus Advantage plans. The original Medicare is the traditional. You have Medicare with Part A and B, which is hospital, hospital, and then doctor, outpatient services. Then you have a supplement and a prescription drug plan. The Medicare Advantage is packaged together, just like our group, the coverage that we have. It's all packaged together where you don't have, sort of 3 different plans. The benefits of original Medicare are you can go to any doctor all over the country who accepts Medicare. Any provider, any doctor, if they accept Medicare, you can go. Under the Medicare Advantage plan, it depends on what kind of plan you have. So they have networks, and you may be in and out of network. So depending on your plan, you may not be able to go to just any Medicare doctor. So it's important to ask that about your parents because you're going to be the one dealing with maybe issues related to their coverage. And the prescription drug coverage is usually included in that. And then long-term care. Do we want to talk about long-term care? You're interested in long-term care. It's something that we actually manage a lot of clients' long-term care policies and helping activate claims. I also am a strong believer. I have a long-term care insurance policy because I was a home care nurse years ago. And when I did home care nursing, I could go visit a patient twice a day and have a home health aide in to take care of the patient all day long, 8 hours a day. Now you get maybe 1.5, 2 times a week, 1.5 hours, 2 times a week. The rest is out of pocket. So it's important to think about it, talk to your financial advisor to see whether or not it's a good option. And I'll talk more about that. Okay, so when we're looking at plans, and this is going to help you if this is, I'm going to back up. The open enrollment period for individuals, for families, for the marketplace, for changing your plan starts November 1st. So that's November 1st through, actually, you can enroll up to January 15th in the state of Connecticut, but that means your coverage is going to start in February. But most people enroll by December 15th with effective coverage on January 1st. All right. So in looking at options, you've got HMO, which is a restricted network. That's where you have the limited, you can't go to just any doctor that you want to. You need to check who's in network. The HMOs are less expensive because less choice, you pay less. And the benefits can be all different. Sorry, PPO. I'm not used to having, I'm like clicking. Click. PPO is you have out-of-network benefits. You can go to any of the doctors, but there's a POS and a PPO. There's confusion because they're not necessarily the same. If you're in the state of Connecticut, you may be able to go to any United Healthcare doctor in the state of Connecticut, but you may not have a national network. And that's sort of the big difference between that company coverage, or if you've got group coverage, if you own a business and you have employees, you have a larger network. So in the state of Connecticut, you have Connecticut or Anthem are the two options on the individual side. Every year the coverage is changing. Last year, Connecticut changed, got rid of their New York, or actually it was a national network that they had, and they got rid of that. So there was no more there was PPO, but it wasn't national. What they did, and this is important to read your mail, is they dropped that plan and they sent to their members that this plan is ending, but don't worry, we'll enroll you in another plan. The plan they enrolled them in had a much more restricted network. And in fact, Yale providers were not in network, and the premium was more expensive. So these are people who had the best coverage you could get that went down to a network that was extremely restricted, and it costs more. So you'd think that that might be illegal, but it happened. So the point being, with the types of plans, you really need to pay attention, and you can call the insurance company, you call Access Health, CT, that's the marketplace, and they can talk to you about, the difference between, or broker, or healthcare Pathfinder. So they can help you choose what's going to be best for you. Don't buy your plan based on the premium, because you're going to potentially get what you pay for. But some people say, oh, I want the best coverage ever, I'm just going to pay the highest premium possible. It might not be the best plan for you. So don't choose it based on just the premiums. Really look at the benefits. Talk to someone who can help advise you. Deductibles. We all have deductibles on our plan. So it's funny, there's people who say, I have the highest deductible, and they work for a company and it's $1,300. I'm like, mine's like $6,500. So why do I have that? Is generally we don't meet the deductible. So we sort of self-insure by and we pay a lower premium to have that type of plan. But you really have to look, if you have significant health issues and you're going to hit that deductible, no problem, then that's worth paying a higher premium. And then looking at a plan, do you want copays? Do you want, what's your experience? Do you want predictability on what your bills are going to be? So copays are when you go to the doctor and you have a $20 bill or $40 bill. So that's a nice experience. And actually that's a great experience if your child, you're paying for their coverage and you're not sure they're going to pay their bills. It's nice to know that they are just paying a copay when they go to the doctor's office. And then out-of-pocket costs. So what you'll see on your coverage is you usually have a deductible, and then you have out-of-pocket maximum. So for example, my coverage is a $6,000 deductible, but my out-of-pocket maximum is about $7,000. And then there's out-of-network. So do you go to doctors who do not accept your insurance? That's when you have to file claims for out-of-network benefits. So it's very confusing. So I'm not going to expect that you're going to pick it all up. So I'm going to keep it going so you can kind of just understand that this is what you need to be looking for and thinking about. Ooh, it jumped. Hold on. I have to go back. Okay. Okay. And provider networks. Just mentioned the in or out of network. So important. And I'll again talk more about it down the road. But have a primary care physician. Some plans you have to have a primary care physician. Make sure you have one for that year, because if something happens, and I had this happen with someone who had signed up for a plan, all he could get was an HMO, but he ended up with an accident like the day after he signed up for his plan. He did not have a primary care physician that was in network. He needed to go to a specialist. He couldn't go to the specialist because he needed a referral from the primary care doctor. The primary care doctor wouldn't write a referral without seeing him. So it ended up delaying the care that he needed. So this is, again, so important to understand the plan you're on and how that can impact what's going to happen to you. Okay, when you must change. We talked about the open enrollment period. So that's currently, just sort of to review it, currently going to happen for Medicare, the 15th through the December 7th. And this is the opportunity for people who are enrolled in Medicare now to change plans. There's the Affordable Care Act, which is AC, and I wanted to share, there's actually an article I read today. So about the Affordable Care Act, and just sort of reminding people that going back to 2014, there was, people couldn't get health insurance because of pre-existing conditions. So people complain about our coverage now. It's really, we're fortunate to have something better than we did, you know, prior to 2014. I used to spend a lot of my time prior to that helping people decide what state they could live in so that they could get coverage. Like people who lived in Arizona, it was crazy. They couldn't get anything. At least in the state of Connecticut, there was a reinsurance plan so people could, you know, go get coverage. I mean, I'll just give you an example of a family I was working with. Her husband had just passed or had passed away. COBRA had ended. She had 3 daughters and they couldn't get insurance because they had, you know, like knee injury from soccer or, you know, like a concussion. So I think it was 2 of the children could not be covered under the family plan because they didn't qualify. So now that just can't happen. So it's just, I think we take for granted, I think sometimes, and some people say, well, I'm healthy, it's not fair. Things change in a second. So I think what I'm saying with this is you have an opportunity to choose your plan and get a better one or spend less, you know, but the premiums are pretty significant. And as Victoria is a big expert on this, is you can get a subsidy depending on your income. And very important, you may think, no, I'm not going to qualify. Very important to just go in and see if you qualify. It might be worth it. So these are the times when you must change: employment ending, retirement, divorce, disability, meaning your job may have ended or you're on disability and you're covered under long-term care or long-term disability, and then you transition over. Death of a spouse, COBRA ending, turning 26 or 65. So all of these scenarios, we call them significant life-changing events that impact your insurance. So important to know in advance what you need to do. A lot of people wait and they're not thinking about the change that's going to have to take place and when you need to deal with choosing new insurance. So it's important to talk to people in advance, especially if you're turning 65. If you have children who are turning 26 and they're on your plan, that means they're going to be aging off that plan. And you might need to help them make sure that they are enrolling in the best plan for you actually to deal with, to be honest with you. Another new client, 34-year-old son, had a traumatic brain accident just about a month ago. Referred to us because his son was on Medicaid, which is the state funding, low income. And he was up in Vermont. So the low income part didn't give him choice. We couldn't just bring him down to Connecticut. He was going to have to enroll him in a new plan. So these are things to think about with your family members and how it will impact you as to what coverage they have. I'm always like asking my children, I'm like, you sure you are on this plan? I'll help you pay for it just to make sure I don't have to pay the balance due for those mistakes. Okay, long-term care insurance. And, oh, 29 in the state of New York. I keep doing this, goes backwards. In the state of New York, you can extend to 29 in certain situations. You wish you knew that. Yeah. No, the problem with New York is, I know, I'll just tell you, they have HMO only. So you don't have any PPO, you don't have a lot of choice, and a lot of doctors don't really accept the state marketplace coverage. And actually Sloan Kettering is actually not even in network and does not accept individual insurance plans. So that's sort of scary. And often we have a lot of clients in New York and many divorced, and the COBRA ends and they've had this incredible corporate type coverage and they're like, what? And it's scary. So it becomes more like catastrophic coverage, but at least they've got something. Okay, so now I'm going backwards. Okay, and then I'll go quickly over the long-term care, and this doesn't work very well. I don't know why. Sorry, guys. I'll just do that. So just if you're thinking about long-term care insurance, what it does is it sort of covers a gap of what your health insurance pays and then what you have to pay out of pocket. For example, the home care services, you have to pay for the private aides. And this is, ask your parents if they have it, because it's really an important policy to review and know how it works so that when they do need care, you maximize the benefits and access to those benefits. But eligibility for it, this is eligibility to qualify for the plan. You actually, they do screenings. It's like life insurance. It's not as easy to get as it used to be. Eligibility for benefits when you have the coverage is activities of daily living, meaning you need assistance with bathing and dressing, or eating or transferring or toileting. Those are sort of what you need to need assistance with from a person to be able to get payment from the policy. If you've got anyone who's using these plans, the claims management, it's just maximizing access to those benefits, having an advocate to help make sure you get the benefits. And then there's significant premiums. And then again, elimination period. So you have a 90-day out of pocket is an example, elimination period that you have to meet before the plan starts paying. So that's long-term care. You didn't want to talk about that anyway. Okay, so be prepared. Legal documents. So everyone, do you have to raise your hand? But just say legal documents. Do I have my power of attorney? That gives someone the ability to speak to your attorney, well, it depends on your financial advisor. There's different types of POAs. There's the of person, power of attorney of person, and of finances. What I want you to just come out of here is just, if you don't have a power of attorney set up for someone to be able to represent you, we have plenty of attorneys that we can recommend. Also is advanced directives, so that if something happens to you and you, again, medically cannot represent yourself, you can make decisions and choices in advance. And whoever you choose to be your representative can make those decisions based on what you decided you want to happen, as far as continuing to be fed or do not resuscitate. So those are the 2 documents: power of attorney, advanced directives, and also get them for your children. So again, that 34-year-old who had traumatic brain injury, he had no power of attorney with anyone. So the doctors were making the choice. I mean, they were working with the family, but there's no power of attorney and no will. In fact, actually, I know someone who's just bought a house from someone who the house is for sale because the 56-year-old died and he had no will, and they have to sell it because it went to no one. So it's in probate. So that's why you need legal documents. Authorization forms. This is release of information. Again, think of this for yourselves, your children, with your insurance company. There's authorization forms. They have different ones for every insurance company, but it gives you the ability for someone to speak on your behalf. And it can be major, and it can take days. It can take weeks for them to actually approve them. And Jenny knows that because we deal with it all the time with clients. It's amazing how long they will take. So if you can get these on file in advance, that will definitely decrease stress when you have a situation that you really need to talk to them. And especially if it's an appeal, someone's in the hospital and you want to appeal it on their behalf, you can't talk to the insurance company, they won't. And that's actually important with Social Security. With Social Security, it's very difficult for anyone to speak on your behalf. And we have a client right now where we've had to actually, there's a separate document, and you're not going to do, this is something you don't do in advance. It's a situation that someone has to, a doctor has to deem them incapable. But again, it's just being aware of these blocks and knowing, that you've got as much as you could set up for you in advance to decrease the stress. Okay. Insurance ID cards. Carry them with you with your driver's license, and tell your children, your mother, whoever. I just had another bill that a client did not, it went unpaid. The insurance company sent it in. I'm sorry, the hospital did not get the ID card, so they didn't call it into the insurance company. So no one paid a bill except for the client. The patient got a full bill from the hospital because there was no insurance on file. And so they got that bill about 3 months later. And the insurance company said, well, the hospital never notified. Hospital said, you never gave us an insurance card. So it ended up being a whole mess. So carrying your card with you, but also your insurance card should, whenever you change your insurance, you need to update all the providers. Never assume that they have the information. So every year you should just make sure, and that's why they usually ask now. But we just had a bill with, it was billed as uninsured under the bill, and it never went to the insurance company. So that this woman was paying $1,000 out of pocket. All right, list of preferred providers. We talked about that, but having in advance, I was again going back to a primary care doctor. Really important to have a primary care doctor. They are your advocate, your medical advocate. Had a situation even just with my husband when he was in the hospital. It's just to have a person who could call, who's not in the hospital, who can call up all the doctors in the hospital and have that conversation, like what's going on, and pulling it all together for you and helping you make decisions. It was just so helpful. And as a nurse and as a family member, they don't necessarily listen to the doctors that are in the hospital. So it's very helpful to have a primary care doctor, or at least some doctor that you can talk to. Okay, and I've said this before, who's your advocate? Have an advocate that you know, family, friend, let them know that you're it. Okay, and then again, continuing to be prepared. If you're scheduled for surgery, so important to have the prior approval with the doctor's office. Is the anesthesiologist in network? Is the outpatient care facility where you're having your procedure done in network? There's all these different levels where you could get a bill. And if one place is out, you're just going to get a bill and they're going to say, sorry. So when you go, if you're going to have surgery in the hospital, you call the hospital billing department and ask them, do you have all the information? Who's doing what? Is everyone in network? Sometimes you can't control it when you go into the emergency room, but there's different protections on that. So that sort of depends on the situation. But we've also had clients who've had surgeries where the doctor's office did not get the approval. They did the surgery. That's the doctor's problem, not yours. That's their fault. But you also want to know how much it's going to cost if it's not approved and figure out how to negotiate and do all that. Inpatient or outpatient observation. Have you all heard of the observation? Observation is when you go to the emergency room, they're going to observe you. They're not going to admit you. So if they're observing, that means you're outpatient. So this is going to apply to your outpatient benefits. This is more important under Medicare, but it may apply to a different deductible versus the hospital. So you may have a different copay. You may have a, $500 copay for being in the emergency room. If you get admitted, it's covered under your hospital benefit, and it might be 100%. So observation can last a couple of days if you don't talk to them at the hospital about what's my status. So when you go into the emergency room, just be thinking about, am I inpatient, outpatient, and talk to the case managers. What does this mean? That's all you really need to remember is, what does this mean? Am I inpatient or outpatient? What does that mean? Where it's very important is, again, with Medicare, if someone stays 3 nights in the hospital, admitted, if they have to go to a rehab, it's covered by Medicare. If you stay 1 night or you're under observation, it's not covered. So you have to pay out of pocket like $14,000 for them to even take you. Okay. Discharge plan. All right, this is just going too fast for me, but it's good. Discharge plan and financial responsibility. Discharge plan should start before you're having surgery. You should be thinking about that. I tell the story about this 87-year-old woman. You can think of your family member. If they have to have surgery, find out, how long are they going to be in the hospital? Talk to the doctor. Often they say they don't know. The insurance will only approve 1 night. But can they come home? Do they need to go to a rehab? Can they go to an assisted living for a week or 2? What are different options? And talk to the doctor about it. The doctors, they're not really actually very helpful. You might want to call a visiting nurse agency, talk to a care manager at the hospital, just to make sure you know what your options are for discharge. People kind of go in thinking that their doctors are going to guide them. They're not usually doing that. I mean, my mom just had surgery on her hand. It was amazing what they did with a 90-year-old and sending her home with a huge wound, with dressing changes, and not saying that maybe we should have a visiting nurse to come out and take care of it. Yeah. And I'm a nurse. I'm like, I can't be there every day. And financial responsibility, just understand so you're not surprised. What are my out-of-pocket costs going to be? Where have I met my deductible? And in understanding that, people often look at they called EOBs, the documents that they receive from the insurance company that say, oh, you owe this much or it costs this much. That doesn't mean that's how much you pay. Also with those EOBs, I always say, call the hospital, call the doctor's office, say, this is what I see, what am I gonna pay? And they may say nothing. So don't get all stressed out about these insurance forms. Also, what they'll do is one day you'll get that MRI was denied because that was when they first got it and they were reviewing it. The next day, you'll get a letter saying it was approved. So you're going like, it's denied. And then you're like, oh, yay, it's approved, but people call and they're like, well, I just got this letter. It's just wait another day or wait till you get a bill. And ask questions. Okay, be proactive. This is women empowerment. I did a presentation for just last week. So being proactive, I'm sort of been talking about it all along the way. Have an advocate. Understand your admission status so that, you can talk to the care managers in the hospital, the discharge planners on day one. And discharge plan. Then when you go, if you have to go to, someone has to go to, I fixed this already. I don't know why it's doing this, but let me just do that. If you feel like you're qualified, your family member needs to go to a rehab after, that's where you may get pushback from the insurance company. And that's very important to know. If you're getting the insurance companies saying, you need to go, you need to go home from the hospital, or you're talking about a family member. You're like, they still have a fever and you don't even know why they're sick. You have the right to appeal, and they have to give you documents stating the insurance has said you're done, and then we'll have instructions on how to appeal. So important to take advantage of that. Case managers are very busy, so they're often not being proactive and really advocating for you. So you need to be asking questions for yourself or your family members. And then, as I said, so even same thing, hospital and acute rehabs. This is especially true with the Medicare Advantage plans. They're getting very strict. Also, the networks are very limited. So you think you go to the hospital, I'm going to have, maybe someone had a horrible accident. You're thinking, I'm just going to go to the best rehab in the area, and it's not a network. You can't go. And your choice is to like subacute skilled nursing rehabs, where you're thinking, I'm going to get the best. So again, you can advocate and you can potentially get to where you need to go. Then home care services, and this is sort of circling back to the beginning of what insurance will cover and what private pay will cover. Often nowadays, people go straight to private pay, and you actually can have Medicare will cover nurses, physical therapists to come out to the home. Again, we're sort of talking older people, but we have there's a lot of, you have an accident or something, you have benefits on these policies that no one's telling you about, and no one's really accessing them. They're just like, we've got a great private home care agency that will take care of you. And maybe that is your best choice and you have the money, but really ask for resources and have a visiting nurse or physical therapist or social worker come out to help out with the scenario that you're going through. Can't say it enough, have an advocate. And then local support services. So for the town of Darien, the Human Service Department is a great resource of local services. There's At Home in Darien, great resources. Even, you think we're all young, but they have transportation that we could actually get rides to a doctor's office if you don't have someone to take you to the doctor. So I always say, look local, and ask. Don't go through all of this alone. There's so many resources out there, but just make sure you check your resources to, talk to a couple of people, especially on the insurance side, when you're looking for your insurance and you're talking to, say, Access Health, the marketplace. You talk to one person and sometimes you talk to another and you get a total different response. So it is a good idea. And if you do go to brokers, find out how many companies they represent. Do they represent more than one? Because that's going to be more options, more choice, and you can really look at your provider network, who's in network, who's not. Ask questions, and just some more resources, just talking about the insurance companies, state marketplace. The insurance companies always write down who you spoke to. If in case you have to go back to them. Human Services Department, government, this thing's not working very well. But advocacy programs, there's the Center for Medicare Advocacy, there's the what's it called? The Association for Healthcare Advocate in state of Connecticut. So that's, you can call if your insurance is based in Connecticut, they can actually be your resource in dealing with an appeal, or if you have any questions regarding or complaints, things of that sort. And I'm sorry, but stress caused by your insurance is not covered by it. I think I didn't say that right. I didn't say it right. Anyway, I'll say it again. I'm sorry, but stress caused by trying to figure out your health insurance is not covered by it. I'm really bad at telling jokes. So anyone have any questions to zero in on this? Because I know it was very broad.
Is Access Health CT, is that a website?
Mm-hmm.
Okay.
Yeah.
So it's accesshealthct.com.
Uh-huh.
It's .org.
It probably is diet.org. Yeah. It's just put Access Health CT. Yeah, it'll come up. So again, that's where you can go in and look at all the different plan options. You can talk to someone when you call in. They can't advise you what to do with your income. They can't, and they also advise sort of, I kind of feel like they're often geared to low income and not realizing the experience that you want to have. So some people are willing to pay more because they know that they don't want to be dealing with surprise bills. Mm-hmm. So they want that lower deductible. Also, you can call Connecticut or Anthem directly to say, okay, these, and you go on their websites and they'll show the marketplace plans, and then they'll show their own plans, and they may have better networks. So you can check the provider networks for that. What else? Anything that you can think of, Vic?
Is that like an Excel spreadsheet type of thing where it actually compares cost of benefits?
Not an Excel spreadsheet.
It's just, you have to go to 20 places to figure out what the difference is.
Well, you can go in and you can compare up, I think it's up to 3 or 4, 3. Again, I'm thinking that we're all in Connecticut. But yeah, you can choose. You can also go in and choose whether or not you want a deductible. That also leads you in with asking what kind of health issues, how often you go to the doctor, things of that sort. So it can,
What is that?
That's Access Health CT. I would just recommend that you might want to talk to a professional, like to talk to a broker. We're fee for service. Some say they don't want to even talk to a broker. They don't want to talk to Access Health CT. They just want us to take them through this process. But definitely call professionals to help you make sure, because it really is kind of confusing, figuring out copay, deductible, which one. The prices are all very similar, but the experience is different. And you got to go all the way through. You should look up your prescriptions. If you have prescriptions, put those in, put your doctors in. You can put that all in to see who's in network, who's not. Call your doctors, say, which company do you like better? That's helpful as well. It's especially important with Medicare, with asking providers, which would you prefer, Medicare Advantage or Original Medicare? And they will say Original Medicare because they hate having to deal with the insurance company. And if anyone has more questions about Medicare, we can answer them after, because there's a lot of changes going on in Medicare. But it's an opportunity to really kind of, you don't know if you have any idea if you're going to have surgery next year or any procedure that you know is going to happen, set yourself up for the right plan. You can change it every year, but you can only change it once, unless you have, a job change or something of that sort.
I have two questions. One is about the marketplace plans and what is happening to the subsidies. I know there was a significant increase in the subsidies and at much higher incomes, but the last I heard, those are phasing out next year.
They're just going down the amount of support and I'm not sure what the numbers are right now, but they've been since COVID. The amount of support that they're providing, it's as far as the government paying, that's what the subsidies are, is the government pays. So when you go into Access Health CT, and sometimes people don't, if they know they don't qualify for subsidy, then people often go directly to the insurance company so they don't have to deal with the marketplace, because it's almost like going into Social Security. You have to put your Social Security number in, you have to identify who you are, kind of like those questions, like what street did you live on, one of these streets. And the system, so what happens with Access Health CT, you enroll in a plan through the marketplace, and then they send it over to Connecticut or Humana. And then Humana, then they enroll you in their plan, and then they send bills and they send the ID cards. So Access Health is just this portal to help kind of everyone get coverage. And it's primarily is for looking to see if you qualify for a subsidy. Did that answer? You had another one?
I had a separate question on the when you talked about the documents, and you talked about legal documents having power of attorney, and then the authorization forms and ROI, which I didn't know what ROI was.
Release of information.
Oh, okay. So
return on investment. Well, kind of return on your invested time.
Yeah, so I was a little bit unsure what the difference was. Like, to me, it sounded like the ROI person would be a power of attorney. So are they the same thing, or are they different things?
Well, you could submit in an authorization form, and if you're signing it for Victoria to be your authorized representative, you can sign it and she doesn't have to have power of attorney. But if Victoria is signing that authorization for you because she wants to speak on your behalf, she has to have a power of attorney to be able to do that. So just think of an adult child. Mom memory has declined. So she has the daughter has the power of attorney. She still has to fill out an authorization and send the power of attorney with the authorization form.
So somebody with the power of attorney can call the shots on the authorization form, but if they don't have.
You have to get it into the, you
So
have
if I
to,
have a designated power of attorney, I get to decide, so it's a much narrower transfer of rights or authority to that person. It's,
help me with that.
So power of attorney.
Power of attorney is, you've got an
It's like
attorney, or
something that
you can get them.
A lot of different rights, including the right to
Mhm.
designate the authorization.
Right. The authorization form is really related to the insurance company only, talking to the insurance company. It has nothing to do with making decisions on the care that they're receiving, except you can appeal and you can look at finding, there's a lot of boxes that you can check as to giving permission for, for us when we're filling out authorizations on our client's behalf. We fill out the forms and they sign them, and then we send them in. So we can call and talk to them about any information related to their coverage, except the only thing they won't let us do is change their login ID or maybe talk related to their premium. But the power of attorney will have the same rights as we do with that authorization. It's just that you may have signed it for your mother. That's where the power of attorney comes in on the insurance side. The power of attorney going to the hospital or going to a home care agency, all that, that's different, where you're really able to make decisions on that other person's behalf. That makes sense?
Yeah. Thank you.
Did you have a
I have
question?
a quick question, kind of unrelated to what we're talking about. Do you know individuals can get health savings accounts?
Yes.
They can.
Yes, yeah, I didn't go into the health savings account. So the health savings account, and I'm doing a presentation later today, that you can, it's related to a high deductible. So it's a I don't know the numbers right now. It's about 1,800 and up with a deductible to qualify. The health savings accounts are triple tax savings. So, if you do it through an employer, it's tax deferred. You can take the money out, no taxes. What people often do, and you can fund it, I think right now it's up to 3,800. And then you get $1,000 if you're over 50 to fund every year. Now that's for an individual. It's up to, I think it's 42. I think it's 42,000. I haven't checked for 2025.
It's 42. also.
It's 42,000, and then it's for a family, it's up to now 82, I think. I didn't check the numbers on that. But the advantage is it's an opportunity to save money in that account. What people often do, which is not the true benefit, is they put the money in there and then they just write their checks and pay for their healthcare out of that account. Ideally, it would be best to invest that money, and long-term you can invest it. But that's, again, talking to your wealth advisor or your accountant to determine whether or not it's worth doing the HSA or not. Because it does separate these assets into a different place, but they could, there are options depending on where you have your HSA. It's through a bank, and you can opt to have them put it in sort of like an IRA, where you can opt to have them put it in funds.
I mean, as a self-employed person, I've always done that, put them in there, put it in there, even though I don't get a tax break. I get a tax break because I then write it off against my tax. I get the $4,200.
Yeah, and then you
Write
can,
off,
every
But
time you,
I don't get it against my income earning.
well, basically when you're paying your taxes, you can write how much you contributed
Right.
so that you're not taxed for that amount. And then when you take out that money, you're not taxed. Like your Social Security, we get taxed for that money.
Is that every state?
Every state for Social Security?
Yeah. Some states were.
I don't think so.
Is it?
It's national. I don't think,
Is it national?
I don't know if states dive into that. But, you know, I know federally, but I don't know if they, that, where states come in on that, it's income. So they may dive into that. I go to the accountant on that one. There's something else I was going to talk about with the health savings accounts. Yeah, well, there's sort of different situations with when you're turning 65 that you have to think about the health savings account, because you cannot be funding your health. You have to stop funding the health savings accounts when you turn 65. There's a penalty.
Wow.
Yeah. Yeah. So if you're still working for a large company, yeah, it's basically, I think it still qualifies. If you're enrolled in Medicare, you cannot be contributing. If you're still working and you did not have to enroll in Medicare, your company is large enough, you can still keep funding. It's just 6 months before you enroll in Medicare. This is so confusing. It goes back 6 months, so you have to stop funding. So Medicare Part A goes back 6 months. So I'll see you all in a couple of years and we'll be talking about our Medicare. But yeah, that Medicare really you gotta know the enrollment. And right now, so important for people to look at their plans. So many are being canceled. Read your mail. Again, going back to Social Security, update your address on file, your name on file. Read your mail, your insurance mail. So many people, policies get canceled because they didn't read their mail. They didn't realize their credit card stopped paying. And they're pretty good about getting reinstatements, but anyhow, I think that's it.
Like I just had a situation where the doctor's practice merged with another practice. It was my doctor who was covered in the, when they merged the new practice, they changed. And I went and they didn't tell me that they changed. And so then I was liable for those bills because I was out of network now. So like, even knowing if your doctor's maybe, if they're still gonna carry your.
Did they give you any kind of, did you negotiate? They wouldn't give you, they wouldn't give you.
They took away the late fees because I didn't even, I was waiting for insurance to pay it. So the late fees were, it wasn't a lot, it was like $20. But
Did they say they sent a letter that said you should talk to your insurance company and make sure?
They never sent any kind of, that they were changing.
So when you went into the office, they had your insurance information and they never notified? I don't.
And
I
there's a
would,
lot of mergers going on, like doctors are moving. and making changes.
yeah, yeah. And they're also so busy that they're just telling you to go to urgent care, and that's expensive. So I always say, you know, don't wait till Friday. And, you know, if you're not feeling well, try to get an appointment. As if you wait, I've had it too many times. They've told me to go to the emergency room because the urgent care is closed. And it's like 3,000, you meet your deductible. So that's it.
Thank you.
Thank you.